Retina surgeons will do an epithelial debridement if the view is suboptimal, but there has to be careful considerations in patients with previous LASIK. The reason why I mention that is there was a relatively recent article that discusses a retina surgeon doing epithelial debridement and was unaware that patients had previous LASIK from 20 years prior, and that alone caused iatrogenic flap trauma. The flap actually inverted on itself, and postoperatively, the defect here resulted in conjunctivalization in that area and several other issues. So the take-home point when planning for epithelial debridement is always take a key history. Ask a patient about previous LASIK. Sometimes the flaps can be very hard to see, especially if it was 15 to 20 years prior, like in that case. So like cataract surgeons asking patients about previous LASIK, if the retina surgeon is planning on doing epithelial debridement, asking about previous LASIK. Before you do the debridement, inspect the flap, and then also do a very careful and gentle debridement. Otherwise, like in the case I just mentioned, there's a risk for flap dehiscence as well as a risk for epithelial ingrowth where the flap, or I should say the epithelium, will slide underneath the flap and cause several other issues. So I have a separate video of that specific article by Uwano et al. Published in the Journal of Case Reports in Ophthalmology, where they highlight this key association between epithelial debridement and in patients with previous LASIK. And again, just taking a key history, inspecting the flap, doing a gentle debridement, that way you reduce these risks. Anyways, I hope you found this video to be useful.